My name is Hoyne, I'm a consultant psychiatrist, and in the series Mental Health Explained, I would like to talk about psychopathy and severe personality disorder. At the end of this lecture or talk, you will understand the concept of psychopathy as it was and as it is currently used, and the terms psychopathy and psychopathic personality disorder was very common under the Mental Health Act in England and Wales, and it was used as part of the mental disorders. And other jurisdictions didn't have this category, and there wasn't any legal definition. Usually at the moment, one would classify these patients under the or within the International Classification of Disease or the American Diagnostic and Statistical Manual for Diseases, the 5th version, as dissociative or antisocial personality disorder. The advantage of this is that these are a little bit more precise and are a consent of international criteria. What is currently used still as psychopathy and is used in forensic psychiatry to predict future behavior and the risk of criminal behavior is the Psychopathy Checklist-Revised. This has been initially designed by Cleckley, but has been adapted to the current version, which I will come to that. Studies in the population show that 0.6% of the general population is affected by psychopathy or could be described as severe personality disorder, and in a prison population it's nearly 8%. It might start in the childhood and go into adulthood, but sometimes people develop it later. So what is a psychopathy checklist revised? It has a series of concepts which describe cold, callous, self-centered, predatory and parasitic individuals who are prone to forensic activities or to criminal activities. And this is in a checklist. Usually they use the checklist. This checklist is called a checklist because it's not a normal questionnaire where people tick yes or no. It's a checklist where the doctor has open or asks open-ended questions, and on top of that tries to get information from third parties or from previous encounters of the person with the mental health services. So coming to this checklist, there are different factors which have been diagnosed in factor analysis. Factor analysis is a procedure where you see which types of items go together or behave in a way that they can be found very often together. And there are two factors. One is more an interpersonal and affective factor, which includes glibness or superficial charm, grandiose sense of self-worth, pathological lying, conning, manipulative behavior, and from the affective side or the mood side, lack of remorse or guilt, shallow affect, callous behavior, lack of empathy, failure to accept responsibility. And the factor 2 is lifestyle factors, which are need for stimulation. A parasitic lifestyle means a lifestyle which depends on others and let others pay for the psychopathic person. Lack of realistic goals, impulsivity, and the irresponsibility for their own actions. There are antisocial behavior parts which show poor behavioral control, early behavioral problems, juvenile delinquency, revocation of conditional release, and criminal versatility. So that's our antisocial acts. And there are two other items, which are promiscuous sexual behavior and many short-term marital relationships. The way it's classified is that 0 is there's nothing in this specific area or specific variable. 1 is there is some evidence, but there's not enough to call it a clear presence of the features. Definitely present is 2, and if it's more severe, then it still stays at 2. If you have a top score of altogether, it could be 40 points, but in the US it would be a score of 30, which is seen as a cutoff to diagnose psychopathy. And in the UK, we're a little bit more, more strict and take a score of 25 as a cutoff score. So these scores are usually define a group of people with antisocial and dissociative behavior. They often have antisocial, narcissistic, histrionic, paranoid, or other borderline personality disorders. The severity is a very difficult concept here, because it could be that either it would be defined by this PCL score, so the higher the score, the more severe, or it could be the severity would be defined by the social impact, possibly by the criminality, or it could be also by the features or by the combination of features of different types of personality disorders. So if you have fulfill several personality disorders criteria, then it would be seen as more severe. So none of this is really making everybody happy. This is why the concept of psychopathy is currently not used in ICD-10 or DSM-5. But it's still used in the classification or in forensic psychiatry. So there is a question, usually when people have a mental disorder, does this make them irresponsible or impossible to be responsible for their criminal activity? And so the question is, if a psychopath has offended and performed a criminal act, are they responsible for that? But most people would say that people who are psychopaths still are responsible for their criminal behavior, and being a psychopath would not give them any impairment of moral understanding, and would not be sufficient to exempt them from their consequences of their criminal behavior. So in total, the concept of psychopathy is very difficult. It's not used anymore. It has been replaced by antisocial, dissociative behavior, and there's high correlation with other personality disorders, as I mentioned before. And one has to see how this concept will develop or come back, if it's useful in forensic psychiatry in the future. Thanks for your interest, and I hope you managed to find something interesting in that, and thanks for listening to the end. I appreciate that. Have a nice evening. Bye-bye.